Hello everyone, my name is Adam Best, and I'm going to be showing everybody today how to cement on a veneer when you receive it back from the lab. It does take a few steps. We have multiple etchants as well as tooth conditioners, and you're going to get something back like this from the lab. And since this is porcelain, there's more steps involved because now you don't only have to treat the tooth itself with different conditioners, but you have to treat the porcelain differently to make it bond to tooth structure. So when we start today, I'm going to go ahead and show you step-by-step process what you would do for each component and when to put it on and how long to wait. So we'll go ahead and start there. Okay, so the first step I'm going to be showing you is how to prepare your porcelain veneer to be bonded to tooth structure. The first step we're going to be doing is using hydrofluoric acid to etch the outer surface. And since this stuff is abrasive and can cause trauma to your tissues, it's really important you wear gloves, a mask, and eye protection to protect yourself. It's very important you do that because this will mess up your skin. So I'm going to go ahead and show you. So the first thing you do is put it in your well. You don't really need that much. You grab a micro brush to apply it, and you're going to scrub it in and let it sit for 30 seconds to etch the porcelain surface. And just like normal etch that we do on a tooth, after 30 seconds you got to rinse this off so that you have nothing left on there. Now we just wait for 30 seconds and we let it set. Okay, now that I believe it's been about 30 seconds, what I'm going to go ahead and do now is rinse this right off. And it's always good to make sure you have it on some type of surface so you don't let it fall out of your hand or fly out, because they are really slippery, they are glassy. And that is the first step to fluoride etching your porcelain veneer. Okay, so now that we've acid etched, our porcelain veneer is now ready to be applied with bonding agent. The bonding agent we use here is monobond S, as you can see. It comes in a little glass bottle. So we do screw it off. Again, use your well. All you need is a tiny amount inside that well. Go ahead, grab some, and apply it for 30 seconds while brushing it into the porcelain veneer surface aggressively to make sure you coat all the glass particles with the silane so that you have good bonding and adhesion to the tooth once you place it inside the mouth. And again, porcelain veneer is very slippery, so it's tough to hold on to. Okay, and now we don't cure this like we would normally our bonding agent. We use our composites instead. You just want to make sure you have just a nice little air layer and just lightly thin out your bonding agent. We don't want to excessively air dry it out. And now your porcelain is prepared and it's ready to be bonded to the tooth structure. Okay, so now that our porcelain veneer is ready, we've already etched it and bonded it. Now we have to prepare the tooth structure to receive the porcelain veneer. So what we do is just like we do with our composites. The first step is etching the tooth to increase the mechanical retention. And what we're going to use for that is, as you can see here, 37% phosphoric acid etch gel. So you're going to apply it on for 20 seconds. And if you want to be safe, you can go ahead and apply a mylar strip in between the interproximal contacts to make sure that you don't etch the adjacent teeth, so you don't bond to them. And so I'm just going to cover the whole facial tooth surface where we're putting the veneer with the phosphoric acid etch. And we're going to wait for 20 seconds. Okay, it's been about 20 seconds. I'm going to go ahead and rinse it off. Alright, and there you go. That's how you etch for porcelain veneer. Go. Okay, so now that the tooth surface has been etched, now it's ready to receive the bonding agent. The bonding agent we use here is Excite F, as you can see. And what we're going to do is apply it onto the tooth, leave it on there for a couple seconds, air dry it to a thin layer, and then light cure it for 30 seconds. So first thing you're going to do is get your Excite F out into the dish. We're going to go ahead and use a micro brush. And we're going to apply it onto the tooth surface. And try to avoid getting on the adjacent teeth, because we want to make sure that when we're done and we apply our veneer that our cement doesn't bond to the adjacent teeth as well. But usually you can use a modular strip to protect the surface. So now I'm going to go ahead and use some light air from a distance to thin out the bonding agent. And as I said, it's important that when you cure it for manufacturer recommendations, which is 30 seconds. So I'm going to go ahead and start light curing it for the 30-second duration. Alright, and that is how you prepare the tooth for the bonding and the final step of the cementation of the porcelain veneer. Alright, what we have here is called VarioLink 2 Trion. As you can tell, it's the Trion cement. The reason we have this is that when you select the cement, especially in the anterior region, sometimes the cement you use has discoloration that can show through that porcelain veneer. So what we want to do here is try in with a, let's say, water-soluble cement that we can put the veneer on and see the actual shade we're going to see once we select our cement. So by selecting a certain shade of the VarioLink 2 Trion, we now know what shade of the final cementation VarioLink we need to choose. So I'm going to go ahead and show you how we would try this in. So you're going to apply just a small amount on the inside of your veneer, just enough to kind of show the areas that you want to see when you cement it on there. I'm going to go ahead and seat the porcelain veneer onto the tooth that we're going to be cementing to. And you're going to go ahead and clean up the excess that you have in the area. I like to use a probe, it's my preferred instrument. And as you can see there, I have picked the perfect shade for this tooth. Okay, what we're using here is called VarioLink 2 Base. As you remember with the first step with the Trion, I've selected the same shade that we used originally to make sure that we have the color choice we want after cementation. There's also a very similar product called Multi-Link 2. The difference being that this is completely light cured. So in the anterior area, we want the least amine content we can inside of our cement so that we don't get, let's say, color change as time progresses. So in the posterior, where you might have a big enough restoration not to get a full cure, it's good to use a dual cure product such as Multi-Link. But here, being in the anterior, very aesthetic zone, we're going to go ahead and use the VarioLink 2 Base. So what happens here is I'm going to go ahead and place a little bit inside my veneer, and then I'm going to place it on the tooth and do what's called the wave technique. What that is just a very light cure that we're going to put onto over the tooth just to cement it on there and hold it barely in place without the cement becoming too hard to the point we can't remove it. So I'm going to go ahead and apply just enough, but you want to have enough that it's going to flow from around the margins, but you don't have so much that you spend forever trying to clean up the mess that you made. So you usually want to put a nice thin layer, and you want to spread it out pretty evenly. And then take out whatever excess you may think may be too much. And I'm going to go ahead now and place this onto the typodont. You want to push it and seat it apically and make sure you get nice good seal on there. So now I'm going to go ahead and do just a 1 to 2 second. When I say 1 to 2, I mean really just 1 to 2 seconds. Just enough to hold it on there while you go ahead and clean up some of the excess cement that's around. Otherwise, you're going to have a very hard time removing that cement. And you just want to remove all your excess. And once you get all your excess removed, then you want to go ahead and light cure for full duration of 30 seconds. Manufacturer recommends somewhere between 10 and 20, but you know, a little extra light cure is never going to hurt you, just to make sure that it's really cemented on there well. You don't want these things falling off. Alright, now that I've removed all the excess cement, I'm going to go ahead and light cure for the full 20 seconds. But the first thing we're going to do is apply one last solution called liquid strip. And the whole purpose of liquid strip is it's going to get rid of that oxygen inhibition layer that normally would be on any type of composite or resin we normally cure. So by applying this, it's going to make sure that you don't have to go through and somehow disintegrate that oxygen inhibited layer. So I'm going to go ahead and apply just a slight amount around my margins on the tooth. And it's just a glycerin gel. It's just a little gel that's pretty much can easily be washed off or rinsed off the tooth afterwards. Alright, now I'm going to go ahead and light cure the tooth. Alright, and now I'm going to go ahead and just rinse off and use floss as well to remove any of the excess cement or any type of glycerin that we may still have anywhere around that tooth, and make sure that we still have a good contact. I have a nice contact here. Switch to the other side, and again go through here with your floss. Make sure you can get through that contact. It's a little tight on this side, but you can get through no problem. And then I'm going to go ahead and clean off the tooth, rinse it off. And there you go. You have your final cemented porcelain veneer. And that is everything that you need to do to cement the veneer.
Thank you, sir.